So, talking more about pharmacies and the amount of abuse, I'm afraid to say, our pharmacists across Coventry and Warwickshire have been telling us at BBC CWR they're getting abused because they can't get enough stock for people's prescriptions, and patients are becoming impatient, frankly, with having to wait longer. Paul Day is the director of the Pharmacists Defence Association, effectively the trade union for pharmacists up and down the country. Joins us now on BBC CWR. Paul, very good morning to you.
Good morning. Happy St George's Day.
And to you too, sir. Thank you for coming on this morning, and a lovely way to start the conversation. Just in terms of the pharmacists themselves, can they be doing more, do you think, to protect staff?
Well, by pharmacists, if you mean the owners, some of the owners are independent pharmacists. Some of the owners are huge multinationals like Walgreens Alliance, like Boots is the biggest one. But, of course, this applies to all Tesco's, Morrison's, wherever there's pharmacies. Yes, employers have got a legal responsibility for the health and safety of their work. And what we've managed to get, certainly the larger ones, to commit to is zero tolerance of abuse. I mean, the abuse, sadly, this abuse happens all the time. It's something we've been campaigning on for years. But in this environment at the moment, with this crisis, with GP practices pretty much closing their doors, other than very essential patients, the volume of people in community pharmacies has increased massively. But also, of course, people standing 2 metres apart, having to wait their turn to even walk in the shop. It's a different environment. But, I mean, responsibility for violence, or be that abuse, threats, anything, sits squarely with the aggressor. I mean, I'm not blaming employers, but, yes, they have a role to play too.
The frustrations that people have had, though, about stock, I'm pretty sure we heard the Health Secretary, Matt Hancock, announce £300 million for community pharmacies in order for them to buy stock, so we didn't have this kind of shortage. So bearing in mind that the money's been given and been offered.
He did say that. It isn't true, and he had to correct himself in the sense that pharmacies are part of the health service. No more, they are private businesses, but so are GP practices.
Right.
They're no more private than that. They're part of the NHS, and they're funded through government to provide NHS services. And what the Health Secretary did promise for England, which is not as an appropriate an offer as Scotland, for example, who are funding them much better, but in England, what he has said is you can have 300 million advance of the money you were going to get anyway. So it's
they'll end up having to pay it back.
Their own money.
Right. Okay. So the funding will be cut down the line.
Yeah, and Matt Hancock did say that in one of his briefings, and then had to issue a correction because he said it was 300 million extra. It isn't. And also, pharmacies, as part of the health service, like much of the public services of the country, have had cut after cut over the last 10 years. So it's been difficult for some of these businesses to stay afloat when they're actually providing the most accessible part of the health service because, some people can, book an appointment, get to their GP, but actually, if you imagine, particularly if you're at the more deprived end of society, if you're on a 0 hours contract, being able to commit to a doctor's appointment, a week away when you don't know what shift you're working, quite difficult, but you can walk into a pharmacy, a critical part of the health service.
So there's a whole list of issues you've heard from pharmacies across Coventry and Warwickshire this morning, Paul: PPE equipment, the stock. Doctors giving out 3 months of prescriptions, but you haven't got the stock in there when people turn up. That's causing them frustration. The social distancing, which means people have got longer queues and longer to wait. What are your members telling you is the biggest issue for you right now?
Well, the biggest issue is them being able to avoid catching this killing virus, make sure they don't spread it to others, to themselves, to their families, to their colleagues, to their other patients. So making sure the PPE is in place and that the protection's in place, just like because we've got members in hospitals and elsewhere, just like all of our members, all the pharmacists playing a part in the health service. So they want to be able to protect themselves. Part of that is being tested so that they know if someone's got it, they can stay away. That is part of it. But on top of that, there's also this issue of patients or customers in these shops being violent in some form to them, which is, the particular issue we're talking about today. But, just like all of our members throughout the NHS, the PPE needs to be in place critically, and they need that testing also.
Paul Day, Director of the Pharmacists Defence Association, with us this morning on BBC CWR.